right. All right. Welcome everyone who is watching, whoever is joining later. Thank you so much. We are live today with Octavia Smith, who is going to teach us or help nursing students um, get ready for their clinicals, or if you're already currently in your clinicals, you're going to be empowered today to do well so that by the time you leave here, you're going to do awesome in your clinicals. You're going to do well. So I'm going to give Octavia the chance to introduce herself to us and let us know a little bit about her. So, Octavia.
Thank you, Indy. Good morning, everyone. My name is Octavia Smith. I'm a registered nurse. I've been a nurse for 8 years. I received my bachelor's degree from Sojourner Douglas College and my master's from Notre Dame University of Maryland. So my master's is in leadership and administration, and then I have a certificate in education. I started my nursing journey as a med surg nurse at Mercy Medical Center, working on one of their step down units for spine surgical patients, and then I later transitioned over to part time nursing supervisor, and then later to the ICU. I left Mercy after 7 years and joined Chase Braxton Healthcare. So I'm now a nursing clinical educator there, which I'm very excited about. I also teach. So I teach clinicals with Coppin State University, and we do our clinical rotation at Johns Hopkins Hospital, the main campus, which is located on Orleans Street. I've also taught for Howard Community College as well as Stevenson University. So that's just a little bit about myself.
Octavia, I went to Sojourner.
You did?
Yes, I'm shocked. I went to Sojourner. That's where I got my BSN too. Oh my
Oh my
goodness.
goodness.
I know.
When did you graduate?
When did I graduate? I don't even remember. I don't remember the year, but when did I graduate from my BSN? I honestly don't remember. But I know it was probably like maybe 2016 or so. 2016, 2015, around that time, because I graduated from my master's 2019. So definitely that's in my head. So it had to be probably between 2015 and 16,
Okay.
I think. Yeah, I think so. Or maybe 2014.
We were there at the same time then.
Oh my goodness. I started at the PG County location, and
Mm-hmm.
then there were courses that we couldn't do over there, so we had to come to Baltimore. So there was a time like mental health, um I think peds, all those other like towards the end,
Yeah.
we were coming to Baltimore every day. Yeah, so definitely I was there for like 2 years or so.
Yeah.
That is so. All right, so we're gonna go. Thank you so much for joining. That is such an amazing background history, you have an experience, you have awesome experience in leadership and education. I used to work as a nurse educator for Genesis Healthcare, and I'm telling you, that's one of the toughest things that you can do, educating and making sure things are going the right way. And because with Genesis, it was also combined with quality health. So you
So
had to make sure that things were going right. Like when the state come for their survey, like every education, people are were educated on certain things and getting their orientation done and everything. It yeah. So
yeah.
awesome, awesome. All right, so I'm going to start sharing your slides and you can just go ahead and let me know when you want to move forward.
Okay.
And of course, this is how to be successful during your clinical rotation by Octavia, of course. So just let me know when you want me to advance to the next slide.
You can go ahead and advance to the next slide.
All right.
So this morning, by the end of this presentation, you'll be able to define the purpose of the nursing clinical rotation, identify the importance of the clinical rotation to your nursing education, and describe how to prepare for clinical rotation, as well as identify the expectation of the nursing student during the clinical rotation. Next slide. So the purpose of the nursing clinical rotation is, one, we want to incorporate everything that you've learned in the classroom into real life situations. So everything that you learned in your theories classes, you've done through coursework, simulation, as well as in the skills lab, you'll be able to combine all of that knowledge into real world situations and apply with what you've learned to taking care of a patient in the healthcare setting. And those settings can vary from nursing homes to assisted living facilities, as well as the hospital. It'll also provide you with a firsthand experience of being a nurse and different patient care scenarios. Everything is going to be a little bit different from what you learn in the book. So you have to be able to take that knowledge and apply it to your patient appropriately according to what condition or situation your patient presents with. And it also involves the students interacting with the clinical nurse instructor, as well as other nursing staff and whatever local healthcare facility you go to. So you have to be able to communicate well with your clinical instructor, the nurses that are working on a unit, as well as any support staff. Next slide. So the importance of the nursing clinical rotation, it provides nursing students with the opportunity to experience day-to-day complexities of offering quality care to patients as a nurse in a healthcare setting. You'll also be able to gain experience with following appropriate protocol for handling patient information. For example, you want to make sure that you're always in compliance with HIPAA, that you're making sure that all identifying information is on whatever specimens that you draw, and that you're also going along with whatever the hospital or institution's policies and procedures are for handling patients and their personal information. You'll also be able to communicate with the patient as well as their family members and, again, members of the interdisciplinary healthcare team. And you can relate to the patients on a personal level while always displaying empathetic behavior and showing that you genuinely care. And you want to be able to perform safe nursing interventions. So you'll those interventions that you learned in school, you'll be able to apply those to your patient. Every intervention is not going to be appropriate for your patient. So you want to pick which one is the best and then apply that to make sure that you're giving that high quality patient care.
Mhm.
Next slide. So before you go to your clinical rotation, you want to make sure you do your due diligence and prepare for that. So you want to make sure that you have adequate travel time. This is one of the biggest things, or one of the biggest hurdles that I've run in with my students, that the day of the clinical rotation, they may be 5 or 10 minutes late because they didn't give themselves that adequate travel time, or they didn't travel to the facility prior to the clinical rotation to see how the parking is, or see how the commute is going to be, or do you have to catch a shuttle bus to get to that hospital or get to that nursing facility that you're going to. So prior to the start of your clinical rotation, drive to the clinical site. Note your travel time. Does it take you 30 minutes? Did it take you 45 minutes? Because you want to add that to the time that you're going to need in the morning when you're getting yourself prepared, or in the afternoon, whenever your clinical may be. And ideally, you want to drive during the day and time of your clinical rotation. So if you have a morning clinical rotation, which usually starts at about 6:45, especially if it's school time where you have a lot of people commuting to work or dropping their kids off at school, you want to do that that drive during that time to see how the traffic is going to be. Okay, don't go on a Saturday or Sunday or weekend
Mm.
when there's not a lot of traffic, especially if your clinical is during a weekday, because you're not going to get a realistic time of how much it's going to take you to travel there, what your commute is really going to look like. Okay, so definitely anticipate some type of traffic. And then you want to verify the parking. Is it local parking? So I know at John Hopkins, they have street parking where you can park on the street around the hospital, but it's a little ways away, so you have to walk to the hospital. So you want to know how much time it's going to take you to walk to the hospital from your parking. If you're doing local parking, which is on the street level, do they offer a garage? What's the distance from the garage to the hospital? Is there a different parking lot that you have to use that may be away from the clinical rotation, that's just assigned to maybe visitors or nursing staff? And is there a shuttle service that you have to take to get to that facility? When I did teaching at Good Samaritan Hospital, they had a designated parking lot for the nursing students, which was quite a way
Oh.
away from the hospital. So you had to catch the shuttle. And the
Mm.
shuttle ran every 10 minutes, but it was also a 10-minute drive from that parking lot to the hospital. So that's an additional 20 minutes you want to add on to your travel time. Okay.
Mm.
And also make sure that you're getting to the clinical site on time. So that's just give yourself enough time. So I highly recommend doing a drive run of wherever your clinical site is going to be at prior to you going, so you know exactly how much time you need. So if clinical start at 6:45, you know that it's a 30-minute drive to the clinical site, as well as an additional 20 minutes to actually get to the hospital, depending on the parking situation. Give yourself an extra hour to get there. It's always best to arrive early than to arrive late. Next slide. So preparing for your nursing clinical rotation, time and attendance. Be on time for all clinical days. Okay, this is the number one thing. If you want to be successful, be on time. Communicate any untoward events with your clinical instructor, not with your classmates. I cannot stress this enough. Your classmates are not the ones that's going to be providing you your grade at the end of this clinical rotation. So you don't want to tell your friend that you're running late and then tell your friend to tell an instructor. As I tell my
Mm.
students all the time, if you don't communicate it with me and communicate it with your friend, it's like it's never happened. So I don't know anything. You have to be responsible for yourself. You are embarking on a new career. This isn't a job. This is a career. This is something that you're going to dedicate your life to, and you want to be successful. And one of the biggest things in nursing is communicating and making sure that you're communicating to the appropriate person. Your classmate is not the appropriate person to communicate that a life event happened that may make you 5 or 10 minutes late. Okay. And then be prepared to accept any disciplinary action related to lateness or absence from your clinical site. You have to complete a certain amount of hours in these clinical rotations. So anytime that you're late, anytime that you miss a clinical day, that take away from the hours that you're going to need at the end. So be prepared to, one, if you show up late and you haven't communicated with the instructor, which would be myself, but you told a classmate, Be prepared to be sent home for that day, okay? Because you didn't do what you needed to do. And it's not fair to the other students who arrived on time that you get to come in late and still participate in this clinical rotation when they did everything that they were supposed to do. And it's just like when you're getting prepared for your job. If you come in late for work, there's going to be some type of disciplinary action that is a result of your lateness or result of your tardiness, okay? So just make sure that you're on time. You may receive a failure for the day. So with my students at Johns Hopkins, they get clinical U's. So if they arrive late or if they're absent, they'll get a clinical U for that day, which is just basically a failure. And then they have to make that day up at the end, either with another clinical group or we can try to coordinate something so the student can come in and do it on another day. But ideally, you don't want to have to do that. You don't want to have to figure out how you're going to make these hours up. So just make sure that you arrive on time and don't miss any days. That's the biggest thing. Be on time. Okay. Next slide. So preparing for your clinical rotation, what equipment do you want to bring? I always stress bring a pen or bring a pencil. Either one is fine. You want to bring a notepad so you can take notes on your patients. No one is expecting you to remember everything that you're doing for your patient or remember these assessments. So you need to have something that you can jot down a note on really quickly that you can refer back to. In clinicals, you may only be assigned one patient. As you get more into your advanced clinicals, as you're doing your critical care, you may get two. So you want to be able to have something that you can write on when you're, so you can know what's going on with these patients, okay? Make sure that you have your stethoscope with you, that you have a pair of scissors to open up any medications or any packaging that you may need, a wristwatch with a second hand so you can use that to take vitals, count respirations. Make sure your uniform is clean, okay? You want to have on your white shoes and your white socks. We do check the uniforms. We want to make sure that you are dressed appropriately, that everything is clean, that you have the correct shoes and correct socks on. And when we say the correct shoes, you want to have some type of cloth, a leather shoe, not cloth. Because if you drop something, some type of specimen, a cloth shoe will absorb that and go right through to your feet. So you want to have some type of leather white shoe on that you can wipe off, okay? Make sure that all of your tattoos are covered. You're in a professional setting. So if you have any tattoos on your arms, on your neck, or even on your face, make sure that those are covered. You can do makeup, you can wear long sleeves, whatever you choose, but just make sure that they aren't visible during the clinical rotation, okay? Body piercings should be removed. So any piercings in your eyebrows, in your lips, in your cheek, even in your tongue, make sure that you take those out. Again, this is a professional setting, okay? No artificial nails, so don't come in with the extra long nails, even though they may be polished very well and look really good, and you have your rhinestones and everything. Those are not appropriate for the clinical setting. One of those rhinestones drop off into a patient's wound, they can be septic, okay?
Oh my God.
So you don't want to do that. Also, no hanging earrings, which is the same thing. The earrings may drop off. I didn't add this, but make sure that you don't have any fake eyelashes on, okay?
Mhm.
Because those eyelashes can drop out again into a patient's wound and they can turn septic from that. So if you have a patient that's just had a surgery and you're doing wound care for them and that eyelash drops down, even though you may think of it as something very small, minute, it's not going to matter. Once it's inside that person's body, it's a foreign object, it's a foreign material. And their body will try to fight that off. And now you've caused your patients undue adverse event when it could have been avoided. I know that we all want to look really good. We want to look our best when we present to the world, but not in this setting. Okay. You can do that on your own time. So don't get like the individual lashes that they put on. If you want to do like a strip, something that you can take off and put back on. So you can take it off of your clinical rotation and then put it back on once you leave. That's fine. But just make sure that you're conscious of that. And then always at the start of your shift, once you've entered into the clinical setting and your shift is about to start, make sure that you have normal saline flushes in your pocket because you're going to need those. You don't want to be in the patient's room and you have to flush out their IV or you have to give them some type of intravenous medication and you don't have a flush. So make sure you put all of that in your pocket at the start of the shift along with alcohol pads. So these are the two things that you're going to use the most during your clinical rotation and during your time as a nurse in the hospital or in a nursing home or even an assisted living setting. These are going to be your best friends, so make sure that you have enough of those in your pocket, okay? Next slide. Okay. So understanding your patient, this is going to be very important. Once the clinical instructor assigns you your patient for the day, you want to go and listen to report. At this time, you're just listening attentively to what the other nurses are exchanging because usually it's going to be either the day nurse give a report to the night shift nurse or the night shift nurse give a report to the day nurse about this patient. At this time, you want to just be listening and taking notes. So this is where your notepad is going to come in, your pen or your pencil, okay? After you listen to the report, then at that point, you can go and review the patient's chart for valuable information that you may not have picked up on in report or that you didn't know what they were referring to. So always make sure that you know the patient name or their preferred name, their admitting diagnosis. What are they in the hospital for? What did they present here for? Was it for surgery? Was it for COPD exacerbation? Did they come in for chest pains? So know what your patient was admitted for. Also know their code status. This is very important.
Mm-hmm.
Patient's code status. Are they a full code? Are they DNI, DNR? Can you do give them air or put them on some type of BiPAP machine? So you want to know this information because if your patient starts to go bad, and we don't ever want that to happen, you need to know what interventions are available for you for that patient. You don't want to go into a patient's room that's DNI, DNR and start doing CPR or chest compressions, okay? You also want to know their admission date. How long has the patient been inside of the hospital or been at the facility? Because that's going to determine your plan of care. So if they're a new admission, then you know it's some different things you may do for the patient versus if there's someone that's been there for 5 or 6 days that's getting ready to go home. Your education is going to vary. So if they're just coming in, you're basically educating them about the hospital stay, what to expect while they're in the hospital, how this hospital course is going to go. But if they're maybe 6 or 7 days in, then you're educating them about what they're going to do when they go home. How are they going to care for themselves once they leave this hospital setting, once they leave this acute care setting? Okay. And you also want to know your patient's isolation status. So you want to know what it is. What type of isolation are they on? Are they on airborne? Are they on droplet? Are they on contact? Are they on all three at the same time? When was the isolation started? Okay. And why was it started? So what condition does the patient have that they need to be on isolation for? Do they have MRSA? Do they have COVID? Is it a TB? So you need to know this information. Usually you can get it from the report. Sometimes it depends on if it's a give back when they're doing report in the morning, but all of this information is going to be inside of the patient's record. So you want to make sure that you're writing all of this down. Okay. You want to know their past medical history. What allergies do they have? And this is very important that you know the patient's allergies. Sometimes patients will have a litany of allergies, okay, to a bunch of different medications, but they aren't necessarily true allergies. They may have taken Tylenol at one point in their life and it caused them to have an upset stomach. Okay. So it's not a true allergy. You want to Focus on the ones where they had some type of adverse reaction. And then you want to also ask the patient, well, what happened when you took this medication? I see you're allergic to ciprofloxacin. What happens when you take Cipro? You need to know this because that may be the only antibiotic that's available to the patient to treat whatever condition they have. So you need to know if it's a true allergy. And if they do have an allergy and they've been prescribed this medication and they had some type of adverse event, you need to be able to communicate that with the provider. Let them know, hey, the patient is allergic to Cipro. I see you've ordered this. Is there something else that we can give them? Okay. You want to look at all test results, including lab work and imaging. You want to make sure that you review the nursing notes and the provider notes. So the provider notes are just going to give you just a basic what's going on with the patient, why did they come in, past medical history. This is what the plan is for them. The nursing notes is where you're going to get your information from about what's really going on with this patient, okay? Is this patient combative, okay? Are they a fighter? Are they spitting? Are they kicking? Are they receptive to the education that you're providing them? They were okay for day shift, but now they're not okay on night shift. So this is where you're going to get a lot of what's really going on with your patient. And that's going to be in your nursing notes, all right? So make sure that you're reviewing those. Next slide. Okay. So planning your care, you want to organize your day. As a new nurse, this is going to be one of the most challenging things, time management, okay? Making sure that you organize your day. So if you have your pen and your piece of paper, you can kind of write down everything that you need to know. So the first thing you want to do is review all your patient care orders, okay? You want to know the time of the patient assessment. Some facilities, you're doing assessment once per shift. So if it's an 8-hour shift, you're doing one assessment, or a 12-hour shift, you're just doing one assessment in that shift. But if you're working on an IMC or ICU, you're doing an assessment every 4 hours. And usually it's at even time. So you'll maybe doing an assessment at 8, at 12, and at 4. So you want to write that stuff down to try to keep yourself organized. And then just check it off as you go along throughout the day, okay? And we're doing focused head to toe assessments based on your patient's diagnosis. So if your patient is there for a FemPop or a below the knee amputation, ideally you want to make sure that you're doing neurovascular checks. So you want to make sure that you're checking the circulation, that they have blood flow going there, seeing if that patient is having any numbness or tingling anywhere. Of course, you're going to listen to their breathing and monitor that, but you're not going to be in the room checking for a third or a fourth heart sound, because that isn't specific to your patient and why they're here, okay? You want to document any abnormalities on your paper prior to entering any information into the EMR, okay? So a lot of hospitals, nursing homes, assisted living facilities, they chart by exception. So you're writing down everything that's not normal, okay? So if your patient had surgery done and they have an incision on their abdomen, then you're writing that down. Patient has a midline incision to the abdomen because that's not normal. Their skin should be intact. Or if your patient has a below the knee amputation on the right leg, you're writing that down, okay? If they're blind in one eye, if they wear hearing aids or wear glasses, anything that's abnormal, you want to be writing this information down. So ideally, you're writing your whole assessment down prior to entering it into the EMR, okay? Because of some EMRs, depending on what the hospital has, you may not have the option to go back and add anything or edit something. You might have to put in a whole new assessment at a different time. So it's good to make sure that you have everything written down, head to toe on your patient, so prior to documenting it. And you also have something to go back to just in case an untoward event happens on your patient. Then you have that notepad to go back to of your assessment. And you can say, hey, I know when I came in here at 8 o'clock, the patient was alert and oriented times 4. And now it's 12 o'clock. and they are alert and oriented times too. So that's a change in condition, and you can communicate that to the provider. Or the provider may come in and see the patient and say, hey, Mr. Johnson seems a little confused. How was he when you saw him this morning? And then you can just go to your notes and say, oh, well, he was alert and oriented times 4. He was okay. No one's expecting you to memorize everything that's going on with your patient, because once you get out into the real world setting, you may have 4 to 5 patients, and you're not going to be able to remember everything that's going on with all 5 of those patients, okay? You also want to write down the time of when your patient medications are due. Do they have 10 o'clock meds? Do they have 11 o'clock meds, 12 o'clock? Write all those times down, okay? So you can plan your day and know how much time you have in between patients to do med passes. So if they have 8 o'clock meds, you can ideally do your assessment and pass your medications at the same time. It allows you to bundle that care for that patient, so you're not constantly in and out of the room. Also know the time of any point of care testing. Did your patient have a finger stick done on a night shift and they need to have one during day shift? What time does it need to be done? Are they doing them every 4 hours? Are they doing it every 6 hours? Is it before meals and at bedtime? So you want to know the time of those point of care testing, because especially for a finger stick, there's going to be a medication that's tied to that blood glucose, which will be insulin. So depending on what the patient's blood glucose level is, you may have to give them some insulin at night or first thing in the morning prior to their breakfast coming. So you want to know the times of those. And you also want to know so you can communicate that to the support staff. So you're going to be delegating things to the nursing support staff. So your patient care associates, you need to be able to tell them that this patient needs a finger stick every 4 hours or every 6 hours or before breakfast or before bedtime, to make sure that that task is done. And if it's not done, then you can follow up with the support person and see what happened, or you may have to go in and do it yourself. You also want to know if the patient has any lab work that they're trending, such as CBC. Are they doing APTT? If your patient is on a heparin drip, you're going to be checking that APTT every 6 hours or according to the provider's protocol. So you want to know when the last time it was done, when the next time is due, okay? Are they trending any CMPs to check on their magnesium levels or electrolyte levels? And does this patient have any wound care? So you want to know all of this stuff and kind of write this down, because this is going to really help you to organize your day, organize your care, okay? And then you need to know if any additional testing is ordered for this patient. Do they need to leave off the floor for a CT scan, for nuclear medicine, for radiology? Are they going for surgery? If they do have something ordered, this will allow you to know, okay, my patient's leaving off the floor at 2 o'clock for a CT scan, and they have 2 o'clock medication. So maybe I need to give those meds at 1 o'clock, okay? Or if you're doing every 4-hour assessments and they're leaving off the floor at 12, maybe you can do your assessment 30 minutes early. So if you know all of that information beforehand, then you can really plan your day and help to manage your time. This is going to be a really big help for you, especially depending on what type of floor or what type of nursing you decide to go into. So if you decide to go into med surge, just know a med surge nurse has between 4 and 6 patients every day. So you want to make sure that you're organizing your day and writing all of this information down. If you're going into the ICU, you may have between 1 and 2 patients, but even though it's a lower number of patients, it's more tasks that you have to do. So you may have to go into the patient's room every 2 hours or every hour. So make sure you're writing everything down to keep you on track. And as you complete those tasks, you can just tick them off so you know that that's done. Okay. Next slide. Okay. And then you also want to make sure that you understand your medications. So understand the reason why the patient is being prescribed certain medications. All right. Your patient may be getting protonics, but they don't have a history of GERD or indigestion. So why is the patient getting medication for indigestion? Well, if your patient had a surgery done, especially if they had some type of laparoscopic surgery done, you have to think when they do those laparoscopic surgeries, they make small incision holes into the abdomen to do the surgery, and air can get inside of there. And that air can cause the patient to have gas. It can cause them to have indigestion. So you want to give them a medication that's going to try to help prevent that. You have to think when your patient has that abdominal surgery, they're having a lot of pain there, and that gas can sit in their chest, and the patient may think that they're having chest pains or that something is wrong with them. So you want to make sure that you're giving them that medication to help prevent that. That way, if they do start to have chest pains, you know that it may not be related to the indigestion or to gas. It could be truly chest pains or something untoward is happening with this patient. So just know why you're giving the medication. Every medication isn't given based on the label. Some meds are given for things outside of what they're labeled for or what they're usually prescribed for. So you want to know the time range and the dosage range of medications, routine as well as PRN. Definitely with your PRN medications, you want to know what the time range is for them, anything you're giving. So if you have nausea medication, for example, Zofran can be given every 8 hours. So you want to know when the last time the patient got it so you can know when they're due for it again. Or if they have multiple nausea medications, they may have Zofran ordered, they may have Reglan ordered, they may have Finnegan ordered. One is every 8 hours, one is every 6 hours, one is every 4 hours. You want to know that, okay? Because if they got Zofran and they're still having nausea, then you know that you have another medication that you can give them. And most importantly, you want to know about your pain medications, especially if you're at a hospital in Baltimore in the inner city. Unfortunately, we do have a big opioid problem here. So you're going to have patients constantly asking you for pain medication, for those opioid pain medications, okay? And you need to know when they're due and when the last time they received it, all right? You also want to know the route of your medication. Are you giving it oral? Is it IV? Are you giving it through the G tube, through the NG tube, or through the OG tube? Okay, because the medication is going to have to be prepared differently depending on how it's being administered. So if you're giving something through a G tube, or NG tube, or OG tube, those meds are going to have to be crushed, mixed with water, and then placed through that tube. But you need to know if the medication can be crushed. Is it something that can be crushed? Is it something that's gel coated that can be crushed, which cannot be? So then you may have to reach out to the provider to see if you can get that medication in a different formulation. And you also want to know your medication effects. You want to know the common effects. You want to know the side effects, and then any interventions that you may need to do based on those effects. So if the patient is taking nausea medication, so they're taking Zofran, for instance, the common effect would be that their nausea stops. But one of the side effects is that they could have increased heart rate or increased palpitation, or they could have an adverse reaction to it. So then you need to know what is the intervention for that in the event that that happens, okay? Always be prepared to educate your patients as well as their family members about medications, and you want to do it in lay terms. So you want to try to keep it as simple as possible and explain it in a way that the patient is going to be easily able to understand this information. Don't use a lot of the medical jargon or a lot of the big words. For example, if your patient is taking Colace, which is a laxative, then you want to explain to them that this medication is a laxative. It's going to cause you to have a bowel movement, all right? You don't want to go in using a lot of big words because they're not going to understand it. You want to make sure that you're speaking to them in lay terms, in the way that they're going to be able to understand and receive the information. Also, you want to be prepared to answer any questions about the medications from the patient, from their family member, and as well as from your instructor. Prior to passing out any medications, the instructor is going to ask you What is this medication? Why is the patient getting it? What are the common effects? What are the side effects? What are the interventions? You need to be able to verbalize that. And don't just read to them from what's in your book. You need to be able to explain it to your instructor the way that you would explain it to a family member. And that lets us know that you know what the medication does. It's not something that you're just reading from off a card and you don't really have any concept or understanding of what this medication is going to do and how it's going to affect your patient. Okay. And it's always okay to ask questions about medications. Ideally, you want to ask the clinical instructor. Yes, there's going to be a nurse assigned to the patient that you're working with, but that nurse has other patients that they're also providing care for. And as a nursing student coming to the clinical rotation, they look forward to that because it takes some tasks off of their plate and they know that you're learning. So ideally you want to go to the clinical instructor and ask them any questions that you have. That's what we're here for, to help guide you, versus going to the nurse with that of that patient. And last but not least, which is the most important thing, do not administer any medications without the clinical instructor. You guys are there working under our license. So if something happens, you administer the wrong medication to a patient, that is going to cause some very negative effects for the nurse, for the patient, for the school, as well as for yourself. So make sure that you're not administering any medications without the clinical instructor being present. We have to sign you off on this. We need to know that you know what you're doing when you're administering these meds. Even though the nurse might be in the room with the patient and you're like, oh, well, the nurse is here, so I went here on and gave the medication. No, everything has to be done in the presence of your clinical instructor. Okay. Next slide. So also you want to understand the procedures. So many patients undergo therapeutic or surgical procedures while they're in the hospital. You need to know the reason for the hospitalization, or what was done during the hospitalization. So for example, if your patient had a paracentesis done, or thoracentesis, or colonoscopy, you want to know why they're getting that procedure done. And then what is the prep for this patient prior to that procedure? So if they're having a colonoscopy, your patient needs to be NPO, which means they can't have anything to eat or drink by mouth. They need to do a bowel prep, which they may have to drink. So you want to make sure that they have all of that. And what is the reason that they're getting this colonoscopy done? Is it a suspicion that the patient may have some type of cancer? Do they have polyps? Do they have a bowel obstruction? What's going on with your patient that they're getting this procedure done? Okay. So you want to know the type of procedure the patient underwent, the reason for the procedure, the expected outcomes, possible adverse events, and potential complications, because you're going to educate your patient about this prior to them going. Okay. So if your patient is there and they're getting surgery done, for example, they may be getting spine surgery done, you want to let the patient know that you're going to be NPO after midnight. They're going to come and take you down to do the surgery. The expected outcome is that they're going to be able to fix whatever condition you had that caused you to have this surgery. So if you're getting a spine surgery done, it could have been a herniated disc or a slip disc, and they want to go in and repair that. Also know that you're going to have some pain. It's not going to be the pain that you dealt with prior to the surgery. It's going to be surgical pain, which is going to be different. So you're going to have to get in and out of the bed different ways. You may can't bend over. You might can't reach up and grab things. Okay. You want to know what are some adverse events that could happen. Well, the major one is that the patient could die. So you want to know that. And then what is their code status? Okay, so all of that ties into each other. And what are some potential complications? Well, if they had a spine surgery, and if the patient is bending over or lifting and doing things that they're not supposed to do, they can dehisce the incision. And that's a complication where that incision has now opened up and they're susceptible to some type of infection. All right. So you want to know that. And of course, always ask questions. You can ask questions of your clinical instructor, anything that you don't understand. Next slide. Okay. And then you also need to understand your laboratory tests. So you want to review the most common lab tests, which is going to be your CBC, which is a complete blood count, a CMP or BMP. So the CMP is a complete metabolic panel. The BMP is a basic metabolic panel. So they have different tests that are within that order. So you need to know which tests are included in that. You want to know your PT, your INR, APTT, magnesium, phosphorus, lipid panel, liver panel, TSH, which is your thyroid stimulating hormone, a UA, a urinalysis, as well as cultures. And you want to also review a few least common blood tests. So you want to know your cardiac markers, your troponin, your BNP, your C-reactive protein, as well as your arterial blood gases. So you want to know what those levels are. What would be considered normal? What would be considered abnormal? Each hospital has their own range that they use. So you can always go into the system and look and see which range that they have that they go by. And if your patient's labs are not within that range, for example, if they have a CBC and you're looking at their hemoglobin and hematocrit, which monitors the amount of oxygen or how the blood is circulating through their body, if that is really low, so if the hospital range is, let's say 10 to 15 is normal, but your patient is a 6 or a 7, then you know that that patient may need to have a blood transfusion. So you can start to anticipate the care that's going to be needed and what goes along with a blood transfusion, okay? If your patient troponin levels are elevated and those monitor the muscles and the heart, then you know that the patient could be suffering some type of adverse cardiac event, that they may need to come off of your floor if they're on a regular med surge floor. They may need to go to a tele floor where we can monitor their heart a little bit better. They may need to go to the ICU. You might anticipate them starting them on some type of IV blood pressure or cardiac medications. So if you know the lab values, if you know what's normal, what's abnormal in relation to your patient, then you can start to anticipate what type of care that patient is going to need or what interventions the doctor may order. So you can start to, again, organize yourself, organize your day, and plan accordingly. You want to understand why these tests may be done, again, in relation to your patient's diagnosis. So if you have a sickle cell patient, of course, you're going to want to know what those CBC levels are and that they may be trending. So the doctor may be ordering those every 6 hours or every 4 hours to see what the patient levels are. So you want to know that information. You want to know the expected normal, again, and abnormal levels. You want to determine if it's high or low, negative or positive. You want to compare these normal ranges with your patient's values, and then be aware of any potential interventions needed in relation to any abnormal levels or abnormal values. Next slide. And then you also want to understand their diagnostic tests. So review and understand different diagnostic tests your patient underwent or has scheduled during their hospitalization. And these can range from a variety of things. They may be getting a chest x-ray done. So if you have a patient that has suspected pneumonia, they know that they're going to get a chest x-ray done so we can look at the lungs and see what's going on. They may need an MRI, and then you need to know what the preparation is for the MRI. So you want to ask that patient if they have any metal inside of their body. Make sure that they don't have any rings or earrings on or piercings prior to them going down for the MRI. Are they getting a CT scan done? Are they having a colonoscopy or paracentesis, thoracentesis, okay? Are they getting a chest tube placed? So you want to know what these different tests are and the reason that they're doing it for your patient. You want to research the test because you may have to educate the patient or the family member about it. So if they're getting a chest x-ray done or CT scan, you want to be able to tell a patient, the doctor ordered you a CT scan, you're going to have to leave off the floor to do this, and they've ordered this for XYZ. So you need to be able to educate the patient and the family member, understand the reason why the test was performed. Also, be prepared to answer any questions from the patient or the family in relation to the test or procedure that they have. And then you want to review findings to determine if they're normal or abnormal, all right? And then again, anticipate possible nursing interventions related to any abnormal findings or additional procedures, surgery, which which may need to be performed. Okay. So if your patient had a CT scan done and they saw a mass inside of their abdomen, they may be going back in for surgery. They may do an exploratory lab to see what that mass is, to see if they can remove the mass. So you want to know, based on those results, what the possible intervention is going to be. That's going to dictate your education that you're going to provide to your patient as well as the patient's family members. It's also going to help you plan your care and be more organized in your day. Next slide. And at the end of each clinical day, be prepared to discuss your patient. So you want to know the patient's diagnosis, any abnormal assessment findings that you noted, and what did you do about those abnormal assessment findings? Was there anything that could be done? Okay, any abnormal labs or diagnostic findings. So what were the abnormal labs? What are the normal ranges? What interventions do you anticipate may be done based on these lab results or on these diagnostic findings? You also want to talk about the orders that you had on your patient. The patient may have had wound care orders in, where you're changing the wound every 4 hours or every 6 hours, or they may have a wound vac on where you have to change out the canister. So what was going on with that patient in those orders, and were they appropriate for that patient? Do you think that they may have changed something? For example, your patient is ordered finger sticks every 4 hours, but they're not on any TPN or they're not on any tube feeding. Those orders may need to be changed to before meals and at bedtime. So, did you think the orders were appropriate for your patient based on their diagnosis? Okay. What did the clinical or the nursing notes say about this patient? And do you think they were reflective of what was going on with your patient, or do you think something else was going on? That the notes didn't give you a lot of information from the patient about the patient. And then how did these findings help direct your care? Based on all of this information, how did you direct your care? And what is the plan of care? What is the plan of care for this patient moving forward? Are they going to remain in a hospital? Are they going to be discharged to a subacute rehab or skilled nursing facility? Are they going home? And what type of additional teaching do you think that they're going to need if they are going somewhere else? And how can you help the patient be prepared for that? And then what did you like about the day? And what did you find difficult about the day? And what would you do differently? Okay, I like, the fact that we were working in an ICU setting and I had a patient that was on a vent. I've never had the opportunity to deal with mechanical ventilation. So I thought that that was really good. What I found difficult was the secretions. I didn't realize that I didn't like secretions. So doing the inline suctioning was very hard for me. And then what would you do differently? Um, you can say, instead of being so grossed out about doing the inline suctioning, understanding why this is needed for this patient to help with their ventilation, to help keep their airway open, or maybe asking the clinical instructor if she can come in the room with me instead of trying to do something on my own, or was something that I didn't understand and I needed more help. And I tried to figure out the answer on my own and I couldn't. And then the next time I'll go to the clinical instructor and ask. So what about the day would you like to do differently? So that's going to be at the end of the day when you do your post huddle once you leave off the floor. These are going to be the questions that are going to be asked of you by the clinical instructor. So be prepared to answer those. Next slide. And that's the end.
Thank you so much. When you were, I don't know if anyone has any questions, you can always post your questions for Octavia to answer. But this like really brought back memories for me. I thought, I was writing some things down when you were talking. For example, the isolation status. I remember sometimes you see someone on isolation and you're like, why are they on isolation? When did it start? Especially in the nursing home, and you'll find out that that person is not no longer on isolation.
Hmm.
But they still have the cart outside the door. They have the sign, on the door. So it looks like the person is in isolation when they truly not. But just because nobody took the time to really ask the question, like you said, when did they start isolation? Why are they on isolation? How long are they going to be on isolation? And vice versa. Sometimes someone is on isolation, but they don't have the appropriate PPE. And you
Hmm.
see family members coming, and again, going back to nursing home, this happened a lot. You see family members coming in, sometimes with a child, and they don't have the proper PPE on, and they just go into the room. So definitely those are things that we need to really, really be conscious of and be mindful. And same thing with medication, the routes, making sure you're giving the right route of medication.
Hmm.
I can't even begin to say how many incident report we had to do because of not giving medication the right way or explaining. And personally, for me, this was a great lesson for me when I went to give a patient medication, and especially if you have a lot of medication, they're asking you, "What are these for? What am I taking the medication for?" And you're like, "Huh?" Then you look stupid in front of the patient, like you don't know what you're doing, and it makes the patient lose confidence in you because they no longer trust that you know what you're doing.
Hmm.
So after I discovered, when I that happened to me once, like honestly only had to happen once, I will learn my lesson. So since then, anytime I had to go administer medication to a patient, I always make sure that I know, okay, there are some medications that you already know, what they're taking it for. It's easy. But there are some that you don't know. So I always had to, write the medication, what they're taking it for, because when once you pop meds, you don't know which one is which anymore. Some
Yeah.
of them are classic, you can know, like say Coles, it's a little red clear pill. That's easy. But there are some that they all look white, and when once you open it, they don't know. And you go there, especially in the nursing home, you have your old patient, like they pour their medicine into their hand and they move this one. What is this for? What is this for? What is this? And you have to be ready to explain to your patient what they're taking all their medications for. So this is definitely, you know, great, 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 great topic. What would you say? Because this was another challenging thing for me during clinicals. And honestly, now, like, I barely do my nails. Sometimes I do have, like, I remember I want to do it, I go do it. But I remember when I was in clinicals, I just wanted to do my nails. Why can't I do my nails? That was like a challenging thing for me. So what is your explanation? Because I think sometimes it's because we don't understand well enough when an instructor tells you, in this, some instructors are more lenient than others. And sometimes when you meet someone that is very, very, I wouldn't say the word strict, but they're like, they know why you're not supposed to do this and they go by it. Sometimes as a student you feel like, oh my god, she's so mean, that instructor, you carry the name. So can you explain again the reason why we have to keep our nails short?
Well, well, what I tell my nursing students when they ask like, well, why can't I wear fingernails? I'm like, okay, just think about your nail. So if you have a long nail on, it's a space between your finger and that nail. You're in the room doing patient care on the patient. Let's say that they had a bowel movement and you now have to go in and clean this patient up. Yes, you have on gloves, but what if that glove pop? Now you have feces
Ooh.
in your nail. Okay. If you have an open cut or something on that hand, or you go to put your hand in your mouth or touch your face, now you've transferred that patient's stool inside of your mouth. You've now put it on your face. We're doing this to prevent infection, okay? Not just the patient, but also for you. You don't want to take home anything that you may have picked up from this patient. You can put a press on now on once you leave from here, something that you can take off and put back on. But while you're in this facility, you want to protect yourself and you want to protect your patient. So just think, when you eat, food gets under there. Just like food gets under there, blood can get under there, feces can get under there, urine can get under there. And now you have all of these organisms under your nail. You've made yourself susceptible to infection, and you're also making your patient susceptible to infection. Not the patient that you're in a room with, but the next patient that you go to. Even if you wash your hands, if you're not really vigorously scrubbing and going under those nails and picking all of that stuff out, and you go over and touch the next patient, now you've transferred that MRSA from patient
Mm.
A to patient B, and
Mm.
also made yourself susceptible to it. And now you've taken that home to your family and to your friends. So it's just best to not have the nail on. Stuff can get under there, and we don't want that. That's why we want you to keep them short. We want you to keep them clean and make sure that you're constantly performing your hand hygiene.
Yeah.
But I find the biggest thing now with the nursing students are the eyelashes.
Mm.
And they won't have the nails on. The nails will be cut down, but they'll have the eyelashes on, and and I'm like, the lashes look great, but you can't come in here with those on. That lash drops off, then what? If it falls on the floor or falls inside of your patient, what are you going to do? So just just don't wear just don't wear it. And I also try to tell them not to wear any jewelry as far as necklaces. If they do have a name tag on, make sure it's one that can clip up onto your collar. Or if you do have like a lanyard, that is one that can pop away. Because if you have a combative patient, your patient may be confused, especially if you're working in a nursing home. Your patient has a UTI, they're older, they're confused. You come in to do care, you lean over them with that lanyard on, and they grab it. It's no way to get that out of their hand. And we actually
Mm.
had that happen to one of the nurses.
Oh
And
man.
it was the patient was choking her, and it took everything in us to try to get that lanyard from out of his hand. Like, he just wouldn't let her go. So she was like stuck hanging over the bed with him holding on to that. So just don't wear that type of stuff, in this setting. If you do, make sure it's something that can snap away. So if the patient does grab you by that lanyard, that it can snap back. And I also tell the patients with their hair, I mean the students, about with the hair. Don't wear your hair down, long hair. Make sure that it's pinned back up into some type of bun, or a ponytail, or that you wear a surgical cap or something on, because the patients can also grab your hair. Or if you're performing wound care or changing the patient, you may get feces or blood or exudate in your hair. So just to avoid all of that, keep it up, take your lashes off, and keep your nails trimmed. Okay. Once you finish school and you go out and decide what type of nurse you want to be, then you might can do that. So if you decide to be an educator, you can wear your low nails or your long hair or your lashes or whatever the case may be. But for this instance, you don't know what type of nurse you're going to be. You're still learning. It's best to just make sure that you're doing everything you can to protect yourself.
Hmm. Awesome.
Yeah.
What would you tell in conclusion, because we're done, what
Okay.
would you tell someone that is brand new? This is their first day. They're about to, like, today's Saturday, Monday they're gonna start their first clinical rotation. and they are nervous, they are worried, they're scared. We were all there. What would you say to them? What words of encouragement, of wisdom that you would give to them today?
I usually tell my clinical students when we encounter this, I tell them to take a deep breath, count to 10. You got this. You know what you know. All right. And you can do this. And if you don't know it, pretend like you do know it, or go get someone that can help you, because the patient doesn't know that you don't know. But if you go in the room and you're nervous and you have that anxiety and that worried look, then that's going to transfer over to the patient. And
Mm.
that's going to make them become anxious or worried and feel like you're not going to be able to provide them with the best care.
Yep.
So just go in and be confident in yourself and be confident in your abilities. You got this. You're going to do awesome. This is the chance for you to make those mistakes and ask those questions
Yeah.
before you get out into the real world setting. So it's okay. You're going to do great. And that's what I'm here for, to make sure that you're going to do great. All right.
Awesome. Awesome. All right. Thank you so much. Thank you for
Thank
coming today.
you.
That was awesome. I hope that, if you're watching it now, if you're going to watch it later, like, this was great, great information for you. And I wish you good luck as you go into your clinical site. Like Octavia said, just know that everything is going to be okay. You
Yeah.
got to start somewhere. And sometimes the first day is always, it's normal for you to be nervous, but just know that it's all gonna be okay. You'll sit one day and you'll be like, oh man, I can't believe I was thinking this or I used to do this. And if you don't know it, ask for help. Don't ever, ever, ever be scared, because the best thing you can do for yourself is ask for help. Because when once someone shows you, it's always gonna be in your head, and you're always gonna remember that time, and it will never leave you. So just good luck, and thank you so much for joining us again. Thank you, Octavia. God bless
Thank
you.
you for having me.
All right.
Everyone have a
Bye.
good day. Bye.
Bye.